Democratic House prosecutors will continue to hammer President Trump in the final day of arguments in the impeachment trial. We're a little over a month away from Super Tuesday, but voters in a bunch of those 14 states can already cast their early votes. The March for Life and anti-abortion rally happened in Washington today, and President Trump was there for the first time. And on today's show, the DNC is spinning big in key states. Trump's new attempt to crack down on immigration and the coronavirus is at Hill TV. Don't worry, it's just an update. I'm Jamal Simmons. Here's why you should care. Soon we'll have a Democratic Party nominee for president, or at least we think we will. And though we are a few months away from knowing who that person might be, the Democratic National Committee is wasting no time funneling millions of dollars in the 6 battleground states: Arizona, Florida, Michigan, North Carolina, Pennsylvania, and Wisconsin. Those are the states the party is targeting first. And they're also states Trump carried in the 2016 election. The Dems know that to win, they've got to go big on the ground game in these key states. The first round of funding will go toward opening up new field offices and hiring organizers to help expand the party's reach. Last time around, Hillary Clinton glossed over certain places. She says that was in part because the DNC didn't have the infrastructure to help scale her campaign up. The party's not taking chances this time around. The Republican National Committee has outraised the DNC, but Democratic candidates have raised $580 million combined in 2019, compared to the RNC and Trump's campaigns combined $463 million. Now, why you should care about all this. The Democrats can't leave organizing for the fall campaign, waiting until they have a nominee. President Trump, he's already focused, and the party is a natural entity to match him. What the party does now will matter a lot come summer being over. The last time the Democrats beat an incumbent president, the party handed over a robust operation to the nominee. If they hope to win again, the DNC has to have its act together. Starting today, the Trump administration is amping up its efforts to curb a practice some call birth tourism. This is when women who aren't U.S. citizens obtain visas, then travel to the United States to give birth so their children can be native-born Americans. This is protected by our Constitution, by the way. According to BuzzFeed, which reported the news first, the new rule will make it harder for women seeking what's called a non-immigrant visa, since it calls for State Department officials to assume that applicants are seeking the visa for the primary purpose of obtaining U.S. citizenship for their child. A draft of the rule obtained by BuzzFeed News reads, "The visa applicant must establish to the satisfaction of a consular officer a legitimate primary purpose other than obtaining U.S. citizenship for a child by giving birth in the United States. In cases where women are looking to gain entry in order to receive better medical treatment due to their countries of origin having poor infant and maternal mortality rates, those women would have to provide proof of being able to pay for it in order to gain entry." Here's why you should care. The White House is saying they want to crack down on birth tourism. White House Press Secretary Stephanie Grisham said in a statement that the policy is, quote, "necessary to enhance public safety, national security, and the integrity of our immigration system." Citizens from mostly Western countries in Europe, Australia, and New Zealand, they don't need a B visa to travel to the U.S. for 90 days or less, since those countries participate in the State Department's visa waiver program. The Trump administration has been chipping away at all forms of immigration, including toying with ending birthright citizenship itself, targeting the most vulnerable of immigrants in the process. Advocates say this new policy, it's no different. A fast-spreading virus that has sickened hundreds of people so far has got World Health officials and citizens across the globe in a frenzy. The coronavirus first emerged in China, causing Chinese authorities to lock down cities with approximately 18 million people in efforts to stop the spread. The World Health Organization says it's too early to declare a global emergency. We have the Hill's Reid Wilson here to help us break this all down. Reid is also the author of the 2018 book, Epidemic: Ebola and the Global Scramble to Prevent the Next Killer Outbreak. Reid, what is going on with this virus?
So this virus emerged out of a live seafood market in Wuhan, China. It is a process by which a virus jumps from an animal to a human called zoonosis. Pretty common. We all have a lot of viruses in us that might not have any bad impact on us from this species, the coronavirus, which really causes like the common cold in a lot of cases. In more severe cases like this one, it's causing symptoms that can include pneumonia and eventually even kill some people. It's killed about 24 people so far out of the 880 or so that we know have been infected. Now, that virus has spread to several countries around Asia, and now there are at least 2 cases in the United States, with another 63 under investigation, mostly travelers who have come back from Wuhan, China. This thing's big and spreading, but it's not huge comparable to other viruses we've seen lately.
All right, so that's what I've got. You said 880, so almost 900 cases in China. 26 people have already died in China. 2,000 people screened in the United States. 63 patients, 2 confirmed, as you just mentioned. I also saw that they are setting up receiving centers at different airports around the country, the United States, for people who are coming from this region of China. They're trying to route them through these different places in order to get screened.
Yeah, and this is what happened during the Ebola outbreak in West Africa a few years ago. The Federal Aviation Administration can basically control how you get back to the country if you're coming back. So they have diverted all passengers from Wuhan into 5 or 6 airports around the country. A few places where there are direct flights, some places where there are connecting flights, but basically every traveler coming into the United States from Wuhan is going to walk by a CDC official who's going to screen them for a high temperature, a fever, or signs of pneumonia, something that would indicate that they might be sick.
All right, but the person in Chicago, it turns out they were not feeling sick when they landed. They went to the doctor with symptoms, and then the doctor sent them to the hospital. So will the screening practices actually help, or is this something that people have to be on guard for days or weeks after they've left the region?
Well, we don't know how long the incubation period is. That is the time between when you actually get the virus and when you start showing symptoms. But the traveler from Washington State, the first case, actually showed up in the U.S. before the screening had started. So now that there is more robust screening in place, that's why we've got 63 people under observation at the moment. We don't know that they have the virus, but at least they were screened as they came into the country.
So this all feels like one of those movies that you see where like the virus is moving across the earth and you can see it spread. How does this compare to what happened in the Ebola situation?
Oh, not even close. Let's be very clear here. There are 26 deaths out of 880 cases. That's what, about 2%. So a tiny mortality rate based on a relatively small number of cases. By contrast, the Ebola virus in West Africa killed somewhere between 40 and 50% of the people who got it. So totally different viruses, not comparable at all. The comparison that we should make is to SARS, the SARS outbreak from 2002, 2003, and MERS, the Middle Eastern Respiratory Syndrome, which has infected about 2,000 people in the last 7 or 8 years. And both of those viruses had much higher mortality rates, but they spread relatively easy. SARS spread more easily than MERS did. This looks like it's spreading about like SARS, but still, again, at a much lower mortality rate. The big thing that we do when we talk about viruses is we get nervous about the new thing. There are 880 cases of this in a world of 7 billion people. There are more than 2,000 people who have died in the United States this year alone from the flu virus. So before we freak out about some new virus, everybody get your flu shot.
All right, so this is not something for everybody to go hit the panic button yet, but be on guard for any symptoms that seem unusual.
Yeah, and the Chinese officials have been very proactive in how they're going after this. You mentioned the quarantines in the 3 cities so far. They've shut down a lot of Lunar New Year celebrations that were going to happen this weekend. People were worried that a lot of traveling during the Lunar New Year would cause the virus to spread too. We've got the screening in place in the United States and in airports around the world. So by and large, the world is moving very quickly to stop this thing. It's not going to be quick enough to stop maybe even a few thousand more cases, but the fact is, nothing to panic about right now. People are just doing their jobs.
All right, thanks a lot. Thanks for watching Hill TV on YouTube. Be sure to click subscribe and hit the bell so you know when we post new videos, and head to thehill.com for all the latest political news.